celebrating the National Latino AIDS Awareness Day. This is an important day for us, and today is a day to create awareness, to talk openly, without taboo, without stigma. Today is a day where we want to inform people about the free resources regardless of immigration status, regardless of age or gender or nationality. Mary Tuit came earlier from Gloria Fox's office. We are grateful that she came here today. Finding ways to protect yourself and your loved ones can help reduce cultural barriers and stigmas around HIV, which sometimes this can prevent us from facing the reality about HIV/AIDS.
As an individual, the steps are just get tested, know your status, know the facts, and get involved. Does it make sense to focus on Latinos here in this corner of the community and Black people here in this other corner when we are like brothers and sisters? I would like to see our efforts conducted in parallel and together with the Black community.
What I can do personally is I can care about the people that are in my social circle, that are in my family, and I can take my role as a provider and share that information with the people around me.
For me, it is a joy, it is a pride to not just represent my community, but also to be within my organization representing that community so that we can have someone that come into us and they can relate to someone who's Latino.
If you're gonna work with young people, you cannot be flaky, and you have to be real. You can't sugarcoat things for them, and you have to be a constant person. You have to be somebody that they depend on.
I was thrilled to be part of the host committee for the first Latino leadership dinner, to host a conversation about HIV among Latino. And I have to say that after this conversation, I really feel empowered to go up there to my community and educate others about HIV prevention, education, and awareness.
We asked women in the community, what do you want us to do to help you? They said if you ladies can create something where we can feel safe, where we can come and no one is going to judge us, no one is going to disrespect us, please create a safety net for us. And that's what we did.
Women come in and housing is a huge issue. Health insurance is a huge issue. Being separated from their families is a huge issue. You know, they have all of these different things that they have to deal with on top of being at high risk for HIV and all kinds of other sexually transmitted infections.
All of our services, I want to say, are free, are confidential, are not dependent on immigration status. We have bilingual counseling. Myself and two of our female counselors can provide counseling to young people as well as to adults as well as to loved ones.
Having kids coming to me 17, 18, 19 years old telling me I'm HIV positive, can you help me? Can you support me? My parents don't understand the meaning of HIV. My family don't know. They still tell me, use this plate and use this fork and use this cup because we don't want to get infected.
I felt it was really important for me to be here and to support this process, specifically around Latinos, because within our culture there's so much stigma as to what HIV looks like and who is infected, and then all the myths that exist out there. And so I felt like as a Latina I needed to be here.
How can we support people in reclaiming who they are as not just a diagnosis, as not just a label?
We cannot impose our own personal values, our cultural values, or our religious values upon young people or anybody in the community. We want to give them the right information. We want you guys to take a personal commitment as to what you're going to do, what your organization is going to do, what your agency is going to do to reduce the HIV in the Latino community in Boston.